Hi guys. So it's been a couple of weeks since my last post, and to be honest, I've been hesitating a little bit to write this post, despite all the amazing energy that everybody's been giving me. Thank you so much for all the beautiful letters. It's giving me a lot of energy. Yeah, but it's getting difficult to post because obviously things are getting like really personal now and a bit uncomfortable. But I'm really committed to sharing this story because I still think that it can maybe help, even if it's helping me. So in the last weeks, I've been doing lots of tests to get chemo ready. I've had bone scans, I had a heart scan, I had a body scan, lots of scans, all coming back pretty good. I even had this new plastic port put in this week. And this port is like a little plastic disc that's underneath my skin with a soft tube, which is called a catheter. And this catheter is going into my large vein. And this is going to make the chemo a whole lot easier. I don't have to sit there and look at the injection in my arm, so they can just put it into my chest and with no dramas. So I'm happy for that decision. But the main focus that we've been focusing on for the last month is preserving my fertility. Most women who are going to go through chemotherapy, or depending on the chemo that you're going to get, if you haven't had children and you still want children, you're probably going to be asked to consider IVF. And that is because in my case, for example, they told me that there is a high possibility during chemotherapy that I will experience menopause, and there is a chance that this remains permanent. I'm doing IVF in Spain, and the cost in Spain, just to give some insights, is around about 7,000 euros per time if it's not covered by your insurance. And that's a little bit more or less depending on the drugs that the doctor's going to tell you to use. So my first round started 10 days after surgery. So on the third day of my period, I started having 2 injections in the stomach, just pinching your fat and injecting yourself, and 1 folic acid pill, and then 1, let's call it the cancer management tablet, which was used to control the estrogen levels, and that was called Femara. And I went to the doctor myself because I decided that I wanted to be the one to inject me, and I felt that that was the most comfortable option for me. And on the 5th day, you start going into the hospital, and then they start doing really regular checks of you, and they start doing internal ultrasounds, and then they also do a blood test, and this can be like every day or every second day around that. And depending on what the doctor sees in the internal ultrasound, and on the blood test, they're going to alter your medication to make sure that you have the best and most mature eggs possible for the extraction. Now, I was so excited watching the eggs grow and counting them that I almost didn't recognize the side effects at all the needles. I just had my eye on the goal. I even had the doctor give me a picture of my empty uterus. So I have my uterus here, and I had all my eggs that you can see here, and I had stuck them on my refrigerator with this nice glitter tape, and this has become my goal. You know, I think I didn't know how much I wanted a family until I was told that possibly that you can't have a family. So then I made a very strong decision that yes, I really want to have a family. So that was a bonus coming out of that. I had 13 eggs. And then they did the extraction on the 9th day. You can imagine from my excitement, I was devastated when they told me that only 2 eggs survived. I know that 2 is better than none, and you only need one, and you know, we should all think positive. But I don't know, somehow I couldn't help the disappointment. I mean, I guess I didn't expect so many of them not to make it. But lucky for us, there's a window from surgery to the chemotherapy, which is 8 weeks, and we're still inside of that window. So we were able to push for a second round. So what the doctors then did is they brought on my period early. And then we started the second round of IVF. So that's where I am right now. I'm now injecting 3 pills a day, 3 injections a day. So I have this one, which is my least favorite one. We have one like what diabetes, looks like a diabetes pen. And then we have this another one, and I am also taking again the folic acids. I have to say this second round, they increased the doses, so and I'm a little less excited. So I think I'm a little bit more psycho. I am a lot more emotional this time round. I cry a lot, unexpectedly, but I'm lucky, you know. I have my coach, so I go see my coach almost weekly, and she gives me lots of exercises that help me release my inner psycho. And I have a patient partner who pretends to love all my personalities, even though I know he's lying. But I'm okay. And I can think about falling pregnant 1 year after everything is done. So once all the treatments are done, and the treatments will start shortly after we're finished with this second round of IVF. And the treatment is going to be 6 months of chemotherapy, followed by either radiotherapy, or still there's a chance of having the double mastectomy. I'm not really fazed by that, but I must say that I am looking forward to the next egg extraction and getting off these hormones. I have to say that I have so much respect for any of my friends who have done IVF, or my friends who are doing IVF, or people who I know are going to do IVF. I send big love to you guys. I think it's a huge dedication, and those are some pretty lucky eggs to have such dedicated parents fighting for them. So the next time that we talk, it'll be chemo time. I'm going to pick up my week next week, so maybe I'll invite you guys to see that. All right, see you. Ciao.